Oh my goodness. Well, I'm still, trying to figure a way to get out of here and on the road. Um, I have things Monday, Tuesday, Wednesday of this week, and then next week I have to see my surgeon again, and I have to see the doctor for my thyroidectomy, which I have put off and put off and put off. But I've got to go and see them for my thyroid medication, which I have to be on the rest of my life. So I have to see if I can find I have to find the thing to take to get a test done for my thyroid levels. Of course, they send me the paperwork like 6 months ago, and now I've got to try to find where it's at so I can go get the tests done. And of course, I'm not finding it now. Mercy. But after that, I'm going to ask if I can come in maybe 2 weeks instead of every week, so I have some time that I can get out. Now, my surgeon, I think he's going to be surprised that I still have dealing with that infection for that wound. And he's going to try to talk me into having a colonoscopy through the stoma, through the stoma. And I'm going, yeah, no. He goes, well, you'll be out for it. You won't be awake for it. No, because at this point, like I said, I'm still dealing with the ramifications from the first surgery. And he said if we go in to reconnect things, try to reconnect things, it will be another huge surgery, which would mean another 3 months, 2 months, 2.5 months before I could even pick up the puppies or do anything. It would be another full-on open surgery from above your navel down to your pubic bone. I mean, yeah, and I'm just at this point going, no. I don't want to go through that surgery again, be hospitalized, and maybe dealing with another infection. I haven't even got this one cleared up yet. So, yeah, when I go to see my surgeon, I'm just going to tell him, and I told him last time when I saw him that I didn't think I am wanting to go for that reconnection, because sometimes they'll do a reconnection and then there's a difficulty and you got to go back to having an ostomy anyway. So if I were in my 20s or something like that, then maybe I would consider it. But I'm 74. How many more years do I have left on this planet anyway? And mine was not regular diverticulitis. I had very, very rare rectal diverticulitis, which he had to wind up taking out quite a bit of the rectum, and then you've got two muscles of what are they? Is it the sigmoid and the sphincter muscles? You got two little sphincter muscles that control the anus, etc. Well, the one, he was not able to repair it. And, everything in there was very friable, which means every place he touched it would bleed. So that's a reason I'm looking at it and going, I don't think I want to go through that attempt to connect it, because being that he wasn't able to repair that could mean I would have issues possibly with evacuating and stuff. So I'm going, I read the complete surgical step by step and what happened with it. I have the full surgical report of it. And like I said, being that that muscle was just leaking air, which it's not supposed to be, was not able to be repaired, I'm just going, with that going on, I don't want to go in there, totally be opened up again, and then find out that, that it's not really able to be reconnected, or if it is, there could be other complications still with that, so I'm looking at this point, telling him, I'm just keeping the ostomy, It's not that I'm worried about him as a surgeon. I think he's a really good surgeon. I like him a lot. Like I said, he's very personable. He will sit and spend the time talking with you about the surgery, everything, He's not one of those doctors that kind of thinks he's above everybody. He is very genuine. And I think he's got a very good skill set for being a surgeon. But that being said, it's my body, and I just am thinking that to try to reconnect everything, that it's just not worth it. Now, don't get me wrong, I'm not really thrilled with having an ostomy. I'm still learning to work around it. But as far as the reconnection, and then finding out that sometimes, again, reconnections do not go as planned, and people wind up having to have an ostomy again anyway, I'm just not willing to put myself through that again. Have to have somebody come out here for a couple of months to help take care of the animals, because it's the healing time is just too much. And I would be, you go to Mitt Lily. Did you roll over, Mitt Lily? Yeah, make myself useful, rub your belly. Yeah, okay. So, I would be like a year out of commission, and I just am not willing to be a year out of commission. I want to be back on the road. So with the wound care center, they were supposed to come in Friday. The doctor said she was going to come in Friday and call and let me know the results of the test. Well, that didn't happen. So I won't find out until tomorrow what they got back from the culture, if I have to be on medication again, antibiotics, because we've got to get this under control before I can take off. It's been a nightmare. It's just, month after month after month of these complications, okay? So I'll find out more Monday. And then, I was going to ask if I could have 2 weeks. Well, that's not going to work, because I still have 2 appointments next week with the surgeon, and then I have to go way the other end to Alamogordo to see the doctor about my thyroidectomy, which I may have to call them and ask them to please send the paperwork again to go get the test done that they need to have for that, because I cannot find the paperwork. Crappus. So anyway, that's what's going on with that. Now, yeah, there's my appointment thing for going to Alamogordo, but I can't find the paperwork. I need to go get the test done. I go, can't I get it done at the VA? They go, no, you have to go to an outside one so he can get the information, because they don't share between the VA and the outside doctors. It's a mess. So anyway, that's what's going on with this. I am going to tell my surgeon, look, I don't want to go in for a colonoscopy. Now, the reason they make you go in for colonoscopy first, they have to make sure you don't have polyps and you don't have cancer or a tumor anywhere else in your system before they go in to attempt to reconnect things. He said it wouldn't be useful to go in and reconnect things and then find out you had cancer or something, and then you know, it just, that would not be viable. It would not be, you know, a way to go. So we have to do a colonoscopy first. But like I said, when he went in and they thought I had regular diverticulitis, there were no diverticulum, nothing. The sigmoid colon was totally clear, totally healthy, nothing wrong at all with it. Okay. I just happen to have a very, very, very rare condition that only 0.1% ever have. Leave it to me to get the really rare one, right? But when they did the, took out all the rectal tissue, they did send it, and I didn't have cancer. That's one thing with this. I guess the rectal diverticulitis, they can confuse it sometimes with cancer. Very similar to having rectal cancer, okay? Although when I had this, it did not present like the regular diverticulitis. I didn't have those types of symptoms. I've never had constipation. I've never had the diarrhea. I haven't had all of those things. Everything seemed normal up until the day it wasn't. So how it presented was all of a sudden I was having this flush, you know, like when you have a cold and you have that mucus coming from your nose, it's you know, kind of viscous, but it's not really heavy. It's more kind of a liquidy type thing. It's like that. But I mean, this mucus was gushing out. I had to wear these Depends and stuff, basically, because so much was just all of a sudden flushing out of my system. You know, at first I tried to just use the little pads and stuff, but you take it off and it would, you know, go running out. So that's how it presented. I had the feeling like diverticulitis, a lot of pain when I'd go to the bathroom. It was like passing glass shards, very painful with that. I did have the pain here. I had also, I was having some low-grade fever. I was having fevers. But the most thing presenting was, again, the pain, going to the toilet. It was like glass shards, very, very painful. And then all of this mucus running out of my body, which you don't get with the regular diverticulitis. Okay? And like I said, I had normal, I didn't have any blood in my stools. I didn't have diarrhea. I didn't have constipation. None of that. So that's how it presented. It was this big flushing of mucus that was the main thing. And then again, feeling like you're passing glass shards when you have to go to the toilet. It was very painful. So they thought, when they did the x-ray, they did a CAT scan, they easy read, it's diverticulitis. Well, yeah, it's more like, I don't know how they got that, because there was nothing in the sigmoid. So I don't know what they thought they were reading with the CAT scan. So, that was just craziness. So, like I said, when my surgeon went in, and they're expecting to find all this diverticulum and diverticulitis in the sigmoid colon, and they go in and there's nothing. It was like, surprise. And then I also had the fistula that was anal vaginal fistula. And when that had opened up, that was after all this mucus was starting, and then all of a sudden I had this fistula that had opened up, and I went in and said, I have an anal vaginal fistula. And they go, well, how do you know that? I said, because I have feces coming out of the vagina. Okay, yeah, you would have. Yeah, that's what that would be. So, that was the other thing that opened and presented. And then I guess there was also a abscess as well. There was an abscess as well. So that's what presented, and why I had to have the surgery that I had, where they took out quite a bit of the rectum. Okay. Maybe they took out a little bit up by the sigmoid, but mostly it was rectum that they had to take out. I'm just glad I don't have to have a Barbie butt, which they have when they have. And they did check the tissue, and I didn't have cancer, so that was good. He said it didn't look like it presented as cancer. So I was fortunate that I didn't have cancer. But again, it presents like cancer. They will say that sometimes this can be confused with cancer. So you have basically the same type of a surgery as you do if you are having rectal cancer. Okay. Yeah. I'm just glad, like I said, I didn't have to have the Barbie butt. But I still do, when you have the ostomy. Now, this freaked me out because they didn't tell me, they said that you have a, what did they call it? Some type of a rectal thing. So I thought that nothing was going to come out of the rectum at all. And about a week or two after the surgery, it felt like I really had to have a bowel movement, okay? And what came out was a big mucus plug, heavy-duty mucus plug. Now, this wasn't that liquid type of mucus. This was gelled, like a big thing of gelled matter with blood. And I freaked out at first because they didn't tell me anything about this happening. So I thought, oh, my God, something's wrong. And then I looked it up in the internet and found out, no, this happens. So about once every 2-3 weeks, it will feel like you have to have a bowel movement, but what comes out is a mucus plug because your bowels are still thinking that everything's connected. And the bowels, I do think, make this mucus to help move things out. But since that's closed off there, it just sits there and gels, and then you feel like you have to have a bowel movement, and you have this mucus plug that will come out of this heavy gelled thing of mucus. Very weird. Okay, so that will continue. I guess maybe that's one reason they have the Barbie butt. They don't have that any longer. But I don't particularly want to go through and have my rectum sewn shut, and go through that. So we'll see. We'll see. But anyway, that's what's going on with it here, why I'm not on the road and why I'm still dealing with the ostomy issues with the doctors, with this infection, and trying to get it cleared up enough that I can be on the road. It's all I want to do. I want to get out and on the road. So on that note, I'll leave that here.